My name's Dr Nina Salooja. I'm a haematology consultant at the Hammersmith Hospital. I've worked there as a consultant for more than 20 years, and during that time I've been a general haematologist, but also contributed to the specialist services for patients who have blood clots and also bleeding disorders. I've set up a joint haematology respiratory clinic for patients who've had pulmonary emboli, and also set up a joint haematology endocrine clinic for long-term survivors of transplant who've been exposed to large doses of chemotherapy and radiation. So I've had a very varied time, but I've retained a strong interest in general haematology. Well, I chose haematology for several reasons. Firstly, the huge variety of conditions. I mean, as I've just described in relation to my own practice as a consultant, I've had all sorts of very interesting groups of patients that I've looked after, as well as general ones. And that's very much a reflection of the speciality. So we have blood cancers, we have autoimmune disorders, we have a whole variety of different types of anemia, as well as all the interesting blood clotting problems and bleeding disorders. So the huge variety was very attractive. I think the second thing that I really liked about it was the range of ages that we treat. So our disorder in our clinics, we'll see patients who might be very old, they might be young adults, middle-aged adults, and haematology departments also have a lot of interesting disorders that actually affect children as well. The final reason is actually the very interesting diagnostic process in haematology. So the haematologists actually had a very early and good grip on the molecular basis of haematological disorders. And in addition, of course, we can take our diseased tissue out of the body and look at it under the microscope. So you end up with a very detailed scientific and visual concept of what's going on in the patient that's making them feel unwell. So I grew up in a very pretty Thameside village called Goring-on-Thames. I was very lucky because all of our neighbours had children my age. So we all used to walk to school together, and then in the evenings we'd all cycle round together or roller skate and have tea together. So I formed a lot of very lovely friendships as a child, which actually I still have now. So I think I was very lucky growing up there. Well, I think one of the challenges of the specialisation is tied up with what makes it so interesting, and that's the huge variety of different types of disorders. And in the last 20 years, our knowledge on every single disorder that we look after has really exploded. And so it makes it very difficult for haematologists to keep up to date with absolutely everything that's going on in that speciality. And as a result, a lot of haematologists have subspecialty interests. And so obviously this makes it much easier for them to practice and to coordinate with other haematologists of similar interests. It can be a bit difficult though, I think, for the patients who are self-referring, or for even GPs who are referring to haematologists, because they're not always sure who is the most appropriate haematologist to refer to, particularly where the diagnosis isn't completely clear. So that can be difficult, but there are some good, well, there's several good general haematologists still around. Well, my friends and family tell me that I'm generally very calm. And I think if I'm in a stressful or frustrating situation, I become extraordinarily calm, almost pathologically calm, whilst I try and think of a pragmatic solution. So that would be my general approach.